Dear student, my name is Dr. Abdulaziz Muhammad Hussein. Today, I will discuss with you the lecture of how to control pain sensation or control of pain sensation. In this subject or topic, I will discuss what's called the pain control system and what's meant by pain control system in our nervous system and how it can act and how it can be activated and its neurotransmitters or neurochemistry and the sites of the pain control system in our nervous system. The second point we will discuss in this lecture, this is what's called the gate theory for pain control. Let us first to start with the pain control system. Pain control system simply or briefly, this is a system that controls the pain transmission in the central nervous system. What's meant by control? Control means increase or facilitate or block the pain transmission. This pain control system mainly inhibit or block the pain transmission in the CNS. That's why we can say this is called endogenous analgesia system because its net effect is what is the analgesia. Look for this diagram or figure. This is a normal pathway for pain perception. Okay, the pain control is another system that the pain control system that will have what's called descending tract. This descending tract will block the pain transmission at the level of the spinal cord, as we will discuss later on. Note the activity of this system differ from one person to another and from time to time in the same person. Some persons having high activity for this system and others have what's called or has what's called lower activity of this system, and also its activity may increase in some conditions in the same person or decrease in some conditions of some persons. For example, the activity of this system is increased by relaxation and decreased by irritability and nervousness. That's why we feel the pain severe when we are irritable, and we feel pain with low intensity when we are relaxed. Okay, what is the evidence or the proof for the presence of the pain control system? Uh, we have, or there are many evidences that prove the presence of the pain control system. The first one, this is called stress analgesia. For example, the soldiers wounded by the heat of the battle may feel no pain until the battle is over. Okay, this is the first. And this how the pain is controlled or blocked or inhibited in these conditions. This is called stress analgesia, and we will discuss this later on. The second evidence, when you have a pain from injured area, the pain perception is reduced when the skin around this injured area is rubbed or stroked. When you make a massage for the skin around the injured area, the pain perception will be reduced. And the last evidence, okay, when you inject the morphine, this is a narcotic drug or analgesic or strong analgesic drug in a small or very small doses in the experimental animal in the third ventricle of the brain, this will produce a marked analgesia. So these are the evidences for the presence of the pain control system in our body. So what are the components of this system? This system has four main components. The first one, this is the area around hypothalamic area, around the third ventricle. This is called periventricular hypothalamic area. This is the first one. The second one, and this is called integration center or the pain control integration center. This is called the periaqueductal gray area, the gray area around the aqueduct of Sylvius, which connect the third ventricle with the fourth ventricle, and this is called the bag area. The third one, this is the nucleus raphe magnus, and this is present in the bones. Also, we have a nucleus reticularis paragigento cellularis. This is present in the medulla oblongata. And the last one, or the last area, this is the pain inhibitory complex, which is present at the level of substantia gelatinosa of Orlandi, or SGR, or spinal gate. This is the main sites or the main regions of the pain control system. Hypothalamic periventricular area, the back area in the midbrain, the nucleus raphe magnus in the brain, in the bones, the nucleus reticularis in the medulla oblongata, and the pain inhibitory complex in the spinal cord. Okay. What about the neurochemistry of the pain control system? This pain control system acts through a release of a group of peptides called endogenous opioid peptides, and these peptides act on a special receptors called opiate receptors. What's meant by opioid? Opioid means opiate-like. So these peptides, okay, these are peptides which act like opiates. Opiates mean morphine. The opioid peptides include three main types or three main groups: enkephalins, endorphins, and dynorphins. Okay, the opiate receptors are 5 types, including delta, kappa, mu, and epsilon, and sigma. Usually, okay, or commonly, the enkephalins binds to the delta receptors, and the endorphins bind to mu receptors, and the dynorphin bind to kappa receptors. The blocker for this receptors, this is called the naloxone, and all of these receptors are blocked by naloxone and activated by morphine, So this mechanism or this control system act by releasing of endogenous opioid peptides, enkephalin, endorphin, and the dynorphin, and acts through opiate receptors, especially the delta, kappa, and the mu receptors. Okay, how this mechanism or this control system can block the pain transmission? This system produce block of the pain transmission by blocking the transmission of the pain at the dorsal horn of a spinal cord, or what's called substantia gelatinosa of Orlandi, via activation of what's called encephalinergic neurons or interneurons at the pain inhibitory complex. Look for this diagram. Okay, this is the presynaptic neuron or the first order neuron for the pain pathway, and this second order neuron. This is the first one, and this second one. And this is what's called the interneuron present in the spinal cord or dorsal horn of spinal cord or pain inhibitory complex. This interneuron secrete enkephalin. This enkephalin can block, okay, the transmission of the neurotransmitter from the first order to the second, which is called substance B, which is called what? Substance B, by binding to a specific receptors in the presynaptic neurons, bind to kappa, mu, and delta. Okay, and when it binds, the enkephalin bind to kappa receptors, it will open what's called chloride channels to allow chloride influx, and this chloride influx will make the neuron or the presynaptic neuron hyperpolarized. Hyperpolarized means when the nerve impulse reach to this region, it become unable to open the voltage gated calcium channels, so no calcium influx. No calcium influx means no release of the substance B, so no activation for the second order neuron. Okay, and sometimes the enkephalin may act through mu receptors, and this mu receptors will open the voltage gated, open what's called the second messenger potassium channels. These potassium channels allow potassium influx or make hyperpolarization of the postsynaptic neuron, or what's called presynaptic block. But mainly it acts by what's called presynaptic inhibition. So this interneuron secrete enkephalin, which act on mainly on delta receptors to block the release of substance B from the presynaptic neuron, so it make specifically presynaptic inhibition, but to less extent it may make postsynaptic inhibition. How we can activate this pain control system? By two ways: supraspinal or spinal. Spinal means we can activate the encephalinergic neurons by signals coming from neurons at the same or spinal nerves at the same level. Okay, by stimulating what's called thick myelinated E beta nerve fibers by rubbing of the skin or massaging of the skin or using counter irritant, or stimulation of the A delta fibers by acupuncture. Okay, supraspinal, and this is occur in severe stress, especially when associated with a strong emotional excitement. Okay, and this is called stress induced analgesia. So we can activate it supraspinal and we can activate it spinal. What about the mechanism of stress induced analgesia? Briefly, this is afferent the first order neuron, and this is the SGR, okay, or posterior horn of spinal cord, and this of the substance B released from the first order neuron to the second, okay, and this is the ascending pathway. This is to reduce pain. This is a normal pathway for pain perception. When you are exposed to severe stress or strong emotion, like the soldiers present in the battle of field, this will activate many areas in our brain, like the cerebral cortex, like the limbic system, like reticular formation and the hypothalamus. All of them will activate the integration center of the pain control system, which is the back area or periaqueductal gray area. When the back area activated, it will activate two centers in the bones: nucleus raphe and locus cellularis. This is by releasing enkephalin neurotransmitters. This nucleus raphe will send afferent to activate the encephalinergic neurons and the SGR via secreting what's called serotonin. And at the same time, the locus coeruleus will secrete noradrenaline. The noradrenaline and serotonin will activate the inhibitory interneuron or encephalinergic interneurons, which secrete enkephalin, and this enkephalin produce presynaptic block or inhibit the release of the substance B, as we can see. So, okay, when you inhibit the release of substance B, this will make inhibition of the B. This is how the strong emotions or exposure to severe stress produce activation of the pain control system and the block of the pain transmission. And this is called stress-induced analgesia. So the stress-induced analgesia activation of the cortex or hypothalamus or limbic system activate the back, and this back activate the nucleus raphe and this nucleus raphe and activate the inhibitory interneurons or cholinergic neurons via release of serotonin. So it inhibits the release of the substance B from the first order neuron to the second order neuron. The second point in our lecture, this is the theory for pain control, or the gate theory for pain control. What's meant by gate? Okay, this is a theory which states that the synapses along the pain pathway are considered as a gate, okay, through which the pain transmission can be facilitated if the gate is open, or blocked if the gate is closed. So we can open the gate so the pain is perceived, and we can close the gate so the pain is blocked, okay, to produce analgesia. The sides of the gate, we have many gates, but the most important gate, this is the spinal gate or SGR gate, substantia gelatinosa of Roland. Also, we have a brainstem gate or reticular formation gate, and finally we have a thalamic gate at the neuron of the posteroventral nucleus of thalamus and intralaminar nuclei of the thalamus. Okay, look for this diagram. This is the first side. Okay, this is a spinal gate or SGR, and this is the reticular gate present in the reticular formation of the brainstem, and this is the thalamic gate present in the thalamus. We have three gates: spinal gate, reticular gate, and thalamic gate. How the pain is controlled at the spinal gate? The pain can be blocked, the pain transmission can be blocked at the spinal gate by two or three mechanisms. Supraspinal pathway by activating the pain control system and finally activate the enkephalnergic secreting interneurons, or spinal inhibition by stimulation of A delta fibers by acupunctures or A beta by rubbing of the skin, or via what's called corticofugal fibers during thinking. What's meant by corticofugal fibers? Fibers coming from the cortex to activate the back area. This is during thinking. Okay, this is the how to control. What are the applications? Okay, for the gate theory for pain control. This theory provides the base for a various techniques or methods for pain relief, including massage of a painful area, applying of irritable substance to a painful area, okay, to a painful area, this is called counter irritant, or transcutaneous electric nerve stimulation or TENS, and this is a TENS, okay. A special electrodes located or placed at the certain area of the skin, and we deliver electric signal or electric current. This electric current will produce rubbing of the skin in this region, and this rubbing will activate A beta nerve fibers, and this A beta nerve fibers will block the spinal gate at the spinal level. Also acupuncture by inserting special needles at special sites of our body. Okay, this is called acupunctures. Okay, as we can see, this is by activating the A delta fibers. So the TENS act by activating the E beta, don't forget, and the acupunctures, okay, will activate A delta. Okay, dear student, finally I would like to thank you, and I hope you understand every point in our lectures, and see you in a next lectures. Thank you very much. Assalamu alaikum wa rahmatullah.